time is 9:13. You're watching CT Style. So spider and varicose veins can often be embarrassing, and sometimes you always try to hide them with your clothing. At least a lot of women do.
Yeah, and joining us here to talk all about it, some non-surgical treatment options, is Thomas Rank. He's a nurse practitioner with HeartCare Associates of Connecticut. We love having you guys here on the show. Tell us a little bit about the different types of veins that people can get.
Sure. So most common is varicose veins, large ropey veins you see on people's legs. Also spider veins are also very common. We met a few of my colleagues previously here, and our vein center at HeartCare Associates, I think, is set apart because we have cardiologists, both vascular surgeon and cardiothoracic surgeons, and therefore we can give a full comprehensive evaluation of your full vascular system.
Veins are not fun,
No.
they're not pretty, and they come with pregnancy.
Right.
But other causes as well.
Other causes. So most common is genetic component, family history. Mom or dad has them, you have a good chance of getting them too. Only thing really to do that you can prevent is wearing compression hose, although there's no good data on that.
Now, how about if you're standing or sitting a lot? Does that help?
Sure. So if you have a job where you're standing, for example, teachers, hairdressers, nurses, it's very common. The way that we evaluate this is an ultrasound in our office. Other symptoms you can have is heaviness, aching, tired, feeling in the legs, cramps at night, and aside from the visual
look of the
veins themselves.
Kind of unpleasant.
Now, how about some of the non-surgical options? Because surgery isn't always necessary.
Sure. So the way that we treat them in the office is using what's called a radiofrequency ablation. And what that means is basically we close off veins that aren't working. The large varicose veins we treat by what's called phlebectomy, where we make a very small incision into the skin and slide very gently the vein out of the skin. Which sounds kind of gruesome.
And it disappears, but then you don't have it, you don't see it.
Correct. And it heals very well. In terms of the spider veins, we use injection, what's called sclerotherapy, and that is the way, basically, it closes the veins off and your body reabsorbs them over time.
Wow.
So there's hope.
Yeah, I didn't realize there were so many options like that, and there's a special going on right now with
Which
CT
we
Style.
like.
Yeah, right. So I just want to reinforce, it's very common underdiagnosed procedure, very common undiagnosed condition, which it's important to talk to your providers, primary care, and it's a medical problem. So
they can be painful too.
They can be very painful. You can have problems with bleeding from them. You can have what's called phlebitis, which is painful.
All right, well,
take care of them, right?
Yeah, I know, and you guys can do just that. We have a free vein screening process on June 21st from 2 p.m. to 5 p.m. at the Hamden location on Whitney Avenue. All you got to do is call to make your appointment. The phone number is 203-407-2500, and if you mention that you saw this segment on CT Style, it's free. So
fantastic.
not too bad, right?
Thomas, thanks for all the information.
Thank you so much.